was first applying to medical school, I knew that I wanted to go somewhere that really allowed me to be a part of that, helping out the Latino community in any way possible, even though I'm not yet a doctor. So I was really excited when I found out that MCG had this Latino student-run clinic and gave me the opportunity really to start interpreting for these Spanish-speaking patients from the get-go. I was like 1 week into school and I was already interpreting, and just like it was very rewarding to see the patients like know what care they're receiving and just minimize the confusion that there might be because of the language barrier. So I would say it's very fulfilling, and just it just like reinforces my plan to help the Latino community in the future.
Clínica Latina is definitely, it's my favorite thing that I've done so far at MCG. Best thing I've done, and it's been incredible to be able to provide care to a population that would normally have trouble accessing it. And that has to do with several factors, but one of the ones that we tackle is a language barrier. You know, when you are in a position where you're seeking healthcare, a lot of times you feel very vulnerable, and it might be extra daunting when you literally don't understand what is being told to you. And so we try to really hard to bridge that gap with the interpreters that we have. Also, a lot of the physicians on board are Hispanic, so that also provides some relief to the patients who are there. And yeah, it's just sort of the disparity that we try to minimize within this community.
For me, it feels like a full circle moment, because I've had family members and my own parents go through issues navigating the healthcare system here because they don't speak English that well. And so I really enjoy having the opportunity and the privilege to be able to serve in some capacity for our Spanish-speaking patients, because the kindness and the support I can give them is the same kindness and support my family has received from strangers. And so it's a really nice way to give back and to honor the people who have helped me get to where I am.
Currently, one of the biggest limiting factors that we have is space, and in terms of like number of rooms that we can use during our clinic nights. And so it's going to be really cool that I think in the next couple of months we're going to have access to a much larger space, be able to see a lot more patients. Every clinic that we have, we always end up seeing more patients than we expect. So hopefully this will make things more efficient and we'll be able to see as many people as possible.
So my sister was born with trisomy 18, so it's like kind of like a rare genetic disease, fatal. And so that was really what sparked my interest in medicine, having to see the pediatrician a lot when I came with my parents, or we had a hospice nurse come to our house every week. And I even had to help like with interpretation between the nurse and my mother, because she didn't speak English at all. And just seeing all those different challenges was really what sparked that interest for me to look into medicine, and ultimately I'm here because of that.
I feel very proud that I am part of this and of this community, and that I have been able to find people that have supported me and helped me to really overcome many of the barriers. And I have been able to successfully develop programs here that not only help the Augusta community and the main culture, but also the underprivileged and the minority communities of Augusta.